Hi, my name's Tristan, and now we're going to be talking about assessment of a child with gastroenteritis in the paediatric ED. So, what's the typical presentation for gastroenteritis in kids? Well, normally they have watery diarrhoea that might be preceded by vomiting, but it might not, and typically they'll have a low-grade fever as well. So, you've got to take a full history, as you do with all children that you see in the emergency department, but the key things to remember here are sick contacts, any recent travel, any suspect food, and I'll put here that I consider any attendance at daycare a sick contact, really, even if you don't know one of the other children are sick. There's just a lot of viruses that they're exposed to when kids go to daycare. The next thing to think about is fluid intake and urine output. Those are absolutely key to ask about, because if they're both normal, the chance of a child being dehydrated is very close to zero. And then there's some concerning features that you want to rule out. So things like severe pain is unusual for gastro, very long duration of symptoms, and there's no clear cutoff for that. But I think anything over a week should prompt a bit more consideration of other diagnoses. And then high fever, bilious vomiting, anything unusual should make you think, okay, is this simple gastro or is it something else? And then the final thing to remember is that vomiting on its own, not enough to diagnose gastroenteritis. There should be diarrhea, and if there isn't and there's just vomiting, you really got to think about other things. So, don't forget DKA, other metabolic conditions, general other infections, because, kids can vomit because of almost any systemic upset. So it's not on its own enough to diagnose a child with gastroenteritis when they only present with vomiting. They should have a full workup for other causes too. In terms of the examination, the first thing to do is just check the observations, because if these are abnormal, then you definitely need to monitor the child a bit more, investigate them a bit more, and possibly institute some management. If they're all normal, that's going to be a good sign that you might be heading towards home, as long as the rest of your assessment is fine. You've got to check for signs of peritonism, so rebound tenderness, guarding, percussion tenderness, psoas irritation, all of those things that suggest there might be an acute surgical abdomen. That's got to prompt you to think, okay, this is not gastro, I need to get a surgical consult. And then finally, assess the hydration status. Whilst this is one of the most important parts of assessing a child with gastro, it's also, unfortunately, one of the hardest, and it's fraught with difficulties. I'm going to come on to this in the next topic, and I'll explain how to try and do it, and then what the problems are with your attempt.